for us to have Loucks, who's the director of Mindfulness Center, Brown University. Brown is one of the top universities in the world, and it's the leading field of mindfulness research. And Eric has a public health background and has 95 publications, and if you're a researcher, that's really huge. Eric has been visiting at Oxford University for the past few months, and Oxford University is another top university for research in mindfulness, and we just had a short conversation, and Eric is inspired by Oxford, and he's got a lot of knowledge from the field of mindfulness in the world, where this field is moving just now. At this point in time, where even in Denmark, where we are such a privileged population, mental health is a huge problem, and we are here today to discuss how to deal with this problem with a top researcher. And at Aarhus University, the Danish Center for Mindfulness, we also do research in public health and in neuroscience and in psychiatry. And Lisa will take us through the public health dimension, and Karen Johanne through the neuroscience, and I will talk something around depression and also around the UN sustainability goals for how to improve or promote mental health and prevent depression. Thank you.
Thank you. So hi everybody. Really, it's a real pleasure to be here. Raise your hand if you know what mindfulness is. Okay, so the majority, but not everybody. Raise your hand if you have meditated at least 5 times in your life. Okay, not everybody, but the majority. Okay. So, I think in terms of just what mindfulness is, I went for a walk a few weeks ago with Sarah Shaw, who's a professor at Oxford University. She's one of the world leaders in some of the historic underpinnings of mindfulness and some of the Buddhist texts, but also is coming out with a book in August on just what mindfulness is. So I was asking her, how do you describe mindfulness? And she said that one of her favorite definitions was from a friend of hers who is a sailor. And he talked about how he feels like mindfulness is like a gimbal, and a gimbal is a soft cushion that a ship's compass sits on. And so that soft cushion allows the compass not to get shaken around. And so she thinks about mindfulness as being that soft cushion that allows us to be right here, right now, and being able to go in the direction that we want to go in. I think probably the most common definition of mindfulness is from Jon Kabat-Zinn, who defines it as paying attention on purpose in the present moment, non-judgmentally. And so mindfulness has 2 components to it. One is that present moment awareness of our thoughts and emotions and physical sensations. But the other piece is the quality of that awareness, that it has elements of non-judgmentalness or acceptance, curiosity, gentleness. And so sort of that idea of, say for me, I know that if I drink too much coffee, for example, I can get a little agitated. And my children now, if they see me drink coffee, they start to really encourage me not to drink it. And so can I use that present moment awareness to notice the agitation that can come up with me when I drink too much coffee, for example? But it's not just the awareness, it's the quality of it. So can I notice it with some curiosity and acceptance, non-judgmentalness, knowing that it's just, for whatever reason, there it is, and I'm drinking it. And by being there and being open to it, sometimes insights can arise. such that, at least in my case, I don't drink much coffee now, just due to my genetics or whatever it is, being sensitive to it. And so those are some of the elements around, just what mindfulness is. If I think of, just how mindfulness, was there a pointer somewhere? Oh, there it is. I'm not sure if that one works or not. I think not. So I'll just use this here. So if we think about just how mindfulness works. So this is a theoretical framework that Yi and Tang. I just saw another pointer go up. Oh, perfect. Thank you. I was like, where did that come from? All right. Thanks. Great. So Yi and Tang and Britta Holtzel and some others came up with this particular theoretical framework that looked at just how mindfulness meditation might influence well-being, or just how it can maybe help us just like self-regulate better. And so one of the mechanisms seems to be attention control, that we're training ourselves to be able to be right here in this moment, but be able to place our mind where we want to place it. So say, for example, if we're doing a meditation on the breath, that we're bringing our awareness to the breath, and then the mind may wander away from the breath. The breath is only so interesting, and maybe it gets a little boring after a bit of time, and the mind just goes somewhere else. We notice where it went to. That's really good information about ourselves and just where we are at today. Does our mind tend to go to the future? Does it tend to go to the past? Where is it going today? And that's good information. And then, without any judgment, we just come back to the object of the meditation, which, say, in this case, is the breath. And so we're training ourselves to be able to place our mind where we want to place it, so that, say, in my situation, say if I come home from work and my daughters come up to greet me, that I'm actually training myself to be right there with them, right in that moment. Or if I'm doing an important task at work, that I'm able to hold on to that task. So it's a little bit like going to the gym for our mind, where we're able to train it to be able to place our mind right where we want it. Another piece of it is around that self-awareness. And so as we're training ourselves to be aware of our thoughts, emotions, physical sensations, what's here? And so that, say, for example, we work on some of this stuff with physical activity in our mindfulness-based blood pressure reduction program, where we have people do physical activity like in class in a mindful way, noticing their thoughts, emotions, physical sensations before, during, and after physical activity. Just about everybody feels good after physical activity for like a while afterwards. And so as we're paying attention to our thoughts and emotions and physical sensations, we're training ourselves to really be there with our body and the mind. And through that process, we start to see when the body and mind feel really good and when the body and the mind don't feel as good. And so that can start to create conditions for behavior change, so that we're fostering well-being in ourselves. And then it seems to also potentially help with emotion regulation as well. So say as we start to get more attuned to our self-awareness, we might be able to detect stressors coming earlier on before they've piled up, and then can start to work with our mind to either place our mind towards the stressors to really understand the root causes of them and to transform them, or to potentially redirect if we have something like repetitive negative thinking, just consistent negative thoughts. If we can ask ourselves, well, are those thoughts helpful in this moment? And if they are, then continue having them. And if not, then we can use that attention control to bring our mind to something that maybe is a little more helpful. So it seems like, this isn't like there's different theoretical frameworks out there. So this isn't necessarily everything, but it does seem to be three major pathways that are often talked about. And so maybe, if you like, just taking a moment to just ask yourself, what brought you here today? What brought you to this set of talks today? And so just taking a moment to ask yourself that and see what answers come about why am I here now? What brought me here? And so what we're doing here is we're using our attention control to place our mind on this question. Why am I here today? We're using our self-awareness to check in with our thoughts, emotions, around what brought us here, why we are here. And so in many ways, when we think about mindfulness or meditation, does it need to be done, with our legs crossed, sitting on a cushion with our eyes closed? Or can it be done in each and every moment of the day? Can mindfulness be something that is always here for us, so that we're able to place our minds where we want to place them and be aware of our mind and the body, and through that harness our entire power to be here for this moment, which is the only moment we ever have. And so that is a big piece around just what mindfulness is and how it can work around potentially helping with well-being. And so, one of the big things that really brought me into mindfulness was a cycling and hiking trip in these mountains, which are the Pyrenees, that are on the border of France and Spain. And so I did a trip with a girlfriend in my mid-20s where we cycled through these mountains and hiked through these mountains. And I was, getting into mindfulness and had a book with me on it that really helped a lot. And so what I was finding is that I was getting grumpy during the days, which is not the best scenario to be with a girlfriend on a trip, having those kinds of things. And so one of the things that this book was teaching me how to do was to be aware of my thoughts and emotions, physical sensations, including difficult ones. And so could I be with that agitation and to almost hold it like a mother or a father would, like a crying child. And so could I be there with those feelings of grumpiness and just sort of noticing it, not judging them, offering curiosity. It's just sort of like if we hold a baby, just holding it can often allow it to settle. And once it's settled a little bit, depends on the baby, including mine, we can start to look at the root causes of why it's crying. Is it got a wet diaper? Is it hungry? Is it tired? Is it cold? Is it hot? And so could I be there with those feelings of agitation and just hold them, and then after some settling, start to look at the roots of that agitation. And then once we can understand the roots, we can often move on to heal those roots. And so what I could see with this is some of the roots of that agitation. One is that we were having these long trips, and in Spain, they eat dinner pretty late, and I was getting hungry, and we just weren't bringing enough food. And so there was a certain hunger element to the agitation. And then the other piece is just like every couple of days I need an hour or two on my own to just reflect on what's been happening so far, what I want to do moving forward, and allows me that kind of peacefulness. And so it was something so very simple that this mindfulness approach was really helping me with, so that we brought in more of those elements around eating more regularly and giving me a couple hours to myself every couple of days, and it went so much better. And so I found out, on that trip that there was a mindfulness center, in southern France that I was able to go to for a retreat, and then that really brought me into the field personally. And then about 10 years ago, looking at the research, seeing that it was really starting to move forward, I decided to move more formally into it work-wise as well. That we've been doing a lot of research on this topic, kind of bringing in elements of physiology and epidemiology and public health and mindfulness all in together with a real strong interdisciplinary approach. So that's some of the ways that got me into this field. And I think being at a school of public health, we do have a population health perspective there. And so just as an example, in the United States, this is data from the National Health Interview Survey, so it's representative of the US population. It's about 60,000 participants in this study. And so you can see just in 5 years, from 2012 to 2017, that the number of people in the United States meditating tripled, and more than tripled. And so we're starting to see population shifts right now in the number of people engaging in meditation or in mindfulness practices. If we think of it from a health insurance perspective, we're starting to see countries increasingly starting to cover evidence-based mindfulness programs like mindfulness-based cognitive therapy and mindfulness-based stress reduction, so that in the United States, for example, increasingly Medicare and Medicaid are covering Mbsr if it's provided by a clinician like a psychologist or a psychiatrist, and billed as group therapy. And covering MBCT as well. We're seeing MBCT starting to be covered in the United Kingdom, for example, in different regions. France is starting to consider it, particularly Mbsr for cancer patients. Germany is now reimbursing for Mbsr and MBCT. So we're starting to see globally health insurance companies and countries starting to look at really reimbursing health insurance for evidence-based mindfulness programs. And then there's just like public interest in really easily accessible programs such as through apps. So just Headspace alone, this is old, I don't know what their most recent, that was about last year where it was valued at $250 million, but 16 million people had downloaded the app as of 2018. Calm is moving even faster. This is another app that has mindfulness components to it, but also relaxing music and stories and stuff too. So it's not just mindfulness, but it's about calming. But there's like 40,000 new users per day right now, and maybe even higher than that. That was as of 2018. And so we're starting to see population shifts in terms of millions and millions of people starting to learn about mindfulness and just starting to practice it. When we think about this kind of strategy, this is a figure from Jeffrey Rose's book, The Strategy of Preventive Medicine. But he talks about how we look at population distribution. So say if we think of lipid levels, like total cholesterol levels, we can see that in Eastern Finland, this is the distribution of the entire population in terms of the relative frequency of people with these different levels of cholesterol compared to Southern Japan. And so what we can see is that someone who has a cholesterol level of around 200 would be considered quite high in Japan and quite low in Eastern Finland as of the time of this data, which is now old. So Eastern Finland has actually responded to this figure and have done some shifts at a population level. And so what is it about populations that can cause this distribution? So at this point in time, Eastern Finland had higher levels of saturated fat intake, for example, and higher levels of alcohol intake. Southern Japan had fairly high levels of fish consumption and vegetable consumption and physical activity. And so that can cause this distribution. So with mindfulness programs, as they're starting to be developed at the population level, can that potentially be shifting mental or physical health in a positive direction? And so that's some of the kind of population level thinking that we're looking at in terms of mindfulness programs right now. And so then in terms of the evidence, I thought I'd show you evidence with a particular emphasis on systematic reviews and meta-analyses. So systematic reviews are approaches where we use multiple databases to look at every single paper on the topic that has been published in the world. And so that way we're combining all the data together from multiple studies. So I'm not showing you like one fancy study that showed an effect, but actually showing you aggregated data across multiple studies that have been done worldwide. And so, one of the areas that I thought I'd really focus on is around mindfulness-based stress reduction, because it was developed about exactly 40 years ago now, and it has gone through some of the most number of randomized controlled clinical trials. And so if we think about, say, impacts of mindfulness-based stress reduction on anxiety symptoms, and so this is a systematic review and a meta-analysis of generally healthy individuals, showing an overall effect, like a Hedges G of 0.6. And so what that number means in meta-analysis land is a 0.5 would be a medium effect size, a 0.8 is a large effect size, and a 0.2 is a small effect size. So 0.6 is about a medium effect size, maybe slightly more than a medium. So in generally healthy individuals, if we're looking at anxiety symptoms, everybody has some amount of anxiety symptoms. Some are very low, some are very high. It's not an anxiety disorder, but simply anxiety symptoms in general. Healthy populations that we see, Mbsr is seeming to have about a medium effect size that's highly statistically significant across these 6 different studies in this systematic review. If we look at this systematic review, this is just in participants with an anxiety disorder, and the total sample size for this study was not that big. I think it was a little over 200 participants across all the studies, so it's still reasonably small. But what we're seeing is some heterogeneity in effects. So just Mbsr are the ones that are circled in the green here, and then the ones that are not circled are related to Mbsr, but not exactly Mbsr. And so what I'm seeing anyway in this data is that, if you look at the overall effect, it's a 0.5, so that's about a medium effect size. It's not quite statistically significant. It might be because there's low sample size, or it may be because there's no effect. we can see some heterogeneity there and one outlier. So when I look at the effects of Mbsr on people with an anxiety disorder, I'm not quite sure yet about its impacts. And if we think of someone with an anxiety disorder, that there can be really strong emotions there. And so with mindfulness, we're encouraging people to be aware of their emotions and thoughts and to come closer to them. And so that, are there ways that we want to adapt or to have a really skilled teacher that is able to meet people where they're at and then help them navigate through? And so that's one of the things that I'm looking at, in the field right now around certainly anxiety symptoms in healthy populations, medium effect size, highly statistically significant. For people with an anxiety disorder, it may well work, but we're not sure yet. But that's sort of what we're seeing with it. This is an example of a participant. This is Joan, who went through one of our mindfulness-based programs. And so when she came into the program, her husband had been diagnosed with early dementia, and he was requiring a great amount of care. And he was at the point where his memory was really declining. He was needing help with basic hygiene issues, and her stress, caregiver stress, it's known to be one of the best or worst causes of stress. So she was very stressed when she arrived. So she had some feelings of anxiety. She probably didn't have a diagnosis of anxiety, but certainly had feelings of anxiety at that point. And this is a quote from her, where she said her husband Mike had been diagnosed with early dementia. My blood pressure was high. Mindfulness and meditation helped me become centered. The panic that I constantly felt gradually decreased, and that panic was replaced by feelings of great love and compassion for Mike. And so one of the things that she went through with the program was coming close to her emotions and her thoughts and seeing that level of stress and seeing that she needed help. And so through that program, she decided to get help and was able to hire someone. She luckily had the financial means to be able to hire someone who came in, and she also began to kind of take that step back with mindfulness. One of the mechanisms that we talk about is called decentering, where we take a step back from our thoughts and emotions. And so she was able to take a step back and to say, yes, he is at this stage in his life, and what a life we've had together. And so she was able to really start to appreciate the life that she's had with him as well. In terms of impacts of Mbsr on stress, this is a meta-analysis of people with breast cancer showing an overall effect of 0.4. So again, 0.5 is medium, 0.2 is small, so sort of in the medium range, a little lower than medium, statistically significant. So in people with cancer, it certainly seems to impact stress. And then in healthy individuals, it's getting to be a large effect size. 0.8 is large, 0.5 is medium, so, and highly significant. And so, it is called mindfulness-based stress reduction, so it's a good thing. It's impacting stress, but I'm feeling pretty confident about the impacts of Mbsr on stress. Here's a quote from a graduate where, I'm aware of my anger, and it relates to this tool of awareness that we have been given. And you're able to say, yeah, that's stress, and step back from that stress to take care of yourself and relax. And so is mindfulness helping us notice when we're stressed now and have the ability to step back from it, the ability to have that self-awareness, to know that the stress is there, and the ability to either lean in, to understand it and its roots and work with those roots, or the ability to step back and engage in something that's going to foster well-being. Around depression, for example, this is again that systematic review in patients with breast cancer, showing an overall medium effect size of depression for participants with breast cancer. So you can see why France right now is considering Mbsr for people with cancer, for example, that the evidence is starting to get pretty strong in this domain. If we look at it in young people, ages 12 to 25, big sample size, a lot of studies, we're showing significant, moderate effects in reducing depressive symptoms, so an effect size of 0.45, so about a medium effect. And then this was a cool study that used a Bayesian statistical approach that combined studies that had randomized people to either Mbsr, cognitive behavioral therapy, which is another evidence-based approach to treat depression, or a control group. And so what we saw for depression is both Mbsr and CBT, cognitive behavioral therapy, outperformed the control groups and had a similar effect size to each other. And so it may be that either one is a viable approach. So it gives people some choice. Maybe that some people don't want to learn about mindfulness and cognitive behavioral therapy might be a better fit for them. And so that would be fine. Or other people might prefer the mindfulness approach, but it's showing a couple different options and showing that they don't outperform each other. And then I think also mindfulness-based cognitive therapy has some of the strongest evidence right now on preventing relapse of depression. And so this is a meta-analysis of individual participant data across multiple randomized controlled studies showing that MBCT outperforms control groups by about 30%. And also they did some other analyses showing that it outperformed active control groups, and it also outperformed antidepressants by about 20% or so. So this was a nice paper in JAMA Psychiatry that came out a few years ago. Here's some qualitative findings on people that have gone through MBCT. This is a nice qualitative paper that came out. And so, someone's saying, I feel more of a whole person after having gone through MBCT, or it's really changed me, it's brought me to life. Or another person sharing, I feel more aware of things, and when I feel sort of depressed, I get on with things and it wears off. I just do one thing at a time. I'm more sort of orderly in control of myself. And so these are some words and reflections on people who went through mindfulness-based cognitive therapy and how it worked for them. So, that was a summary on impacts of Mbsr and MBCT on mental health, and I also thought I'd touch on physical health a little bit as well. And so one of the areas is around blood pressure. And so this is a systematic review and meta-analysis that showed 4 studies as of 2014. This needs an update now. And the ones that were straight up Mbsr are all circled there. And so there was an overall effect of all 4 studies together. If we take this study out, that was a bit of an outlier, it's no longer statistically significant. The effect sizes aren't all that big. So we're not quite sure yet if Mbsr impacts blood pressure, but there are some more recent studies that are coming out suggesting there may be an effect. But it did cause us to develop an adapted program called Mindfulness-Based Blood Pressure Reduction, where it's time matched to Mbsr, but we bring in more training on the things that we know influence blood pressure, things like physical activity and diet, antihypertensive medication adherence, alcohol consumption, so that we train people up in those mindful skills of self-awareness and attention control and emotion regulation, but then direct those skills towards their relationship with the things that we know influence blood pressure, like their physical activity and their diet. So we're doing actual programs within the class on diet and physical activity and medication adherence. And so what we're seeing with them is that for everybody, blood pressure is coming down about 6 millimeters of mercury and holding over 2 years. But all the action is in people with uncontrolled hypertension or stage 2 hypertension. So these are people with systolic blood pressure over 140 or diastolic over 190, or 90, sorry. So for these folks, we're seeing blood pressure coming down 15 millimeters of mercury and holding 2 years, which from a clinical perspective is very large. We have a randomized controlled trial in the field right now that will be a sample size of about 200 participants, it looks like, so I'm holding my breath. This was sort of the first study to give us a feeling for what's going on there, and holding my breath to see what the randomized controlled trial shows. Around pain, this is one of the areas that John Kabat-Zinn, the founder of Mbsr, first started to research. And so if we look at the evidence for pain, this is that Bayesian statistical approach that looked at randomized controlled trials of Mbsr or CBT or control, seeing that both of them seem to have some effectiveness versus the control group, similar effect sizes, bit more heterogeneity in the effects for Mbsr. If we look at participants with low back pain, for example, this is a systematic review of studies where we can see that for short-term effects that Mbsr outperforms a usual care control group, but it doesn't outperform active comparators like cognitive behavioral therapy or health education. So if a participant is given Mbsr for low back pain, it certainly seems to work for short-term pain. If they're given, say, Mbsr or cognitive behavioral therapy or something else, it's not necessarily outperforming another viable approach. The long-term effects of mindfulness-based stress reduction on pain are not well researched yet. There's just a couple studies on it so far, but it is promising in terms of the long-term effects, but it's a little early to know. Another piece of it is cost effectiveness. And so it's one thing about if Mbsr works to reduce pain or anxiety symptoms or depression, but it's another about what it costs society and health insurers to do that. And there's only maybe 4 or 5 cost-effectiveness studies that I'm aware of in the entire mindfulness field right now. So this is a real area of opportunity. This is one of the better ones I've seen. This was 342 participants with low back pain that were randomized to get either Mbsr or cognitive behavioral therapy, another evidence-based approach to bring pain down or usual care. And so what we saw was that for cognitive behavioral therapy, that it added about $125 of cost to society for people that went through it. So, pain is a very expensive condition, so adding an extra $125 is not a big amount. With Mbsr, it actually brought the cost down by about $700. So it actually saved the societal cost by $700. And then if we look at the cost to the health plan, cognitive behavioral therapy added about $500 of cost to the health plan. But again, if it's working to reduce pain, that's not a major investment. Mbsr actually saved almost $1,000 to the health plan. So, I think that's another big piece of it from a health insurance perspective is what I'm seeing with health insurers is, one, they want to know if it works, and 2, they want to know what it's going to cost, and so that it's not wasting taxpayers or their own insurance members' money. And so if Mbsr is working to improve outcomes like pain and it's actually saving costs, then that starts to become a very strong argument, which I think is one of the reasons why we're seeing Mbsr starting to get picked up by health insurance companies and governments. Again, for me as a researcher, I'd like to see this replicated, but the findings so far of the cost-effectiveness studies are promising. And I know, Lona, you've done some work with this too and seeing some positive results too, with chronic pain, I believe, as well, right? So, so we are seeing some work come out, including out of Denmark. Here's another quote from a mindfulness-based program graduate. So, this program has helped me immensely. I feel more grounded, more joyful, more prepared to meet the challenges of my life with openness and wisdom. And so these are some of the ways that we're seeing mindfulness-based programs come forward, and this is some of the strongest evidence that I'm seeing so far anyway, through systematic reviews and meta-analyses for the impacts of things like mindfulness-based stress reduction on mental health as well as physical health. In terms of future directions for the field, I think I was talking with Lona earlier about this too. I've been on sabbatical in Europe for almost 3 months now, and then I'm director of the Mindfulness Center at Brown University, and so and we're also going through a major strategic planning process with our center so that we are getting advice from definitely hundreds, probably getting close to 1,000 or so people on just where they feel the mindfulness field needs to go and what is really up right now for research and for care of society. And so these are some of the areas that I'm really hearing a desire to grow and develop in terms of future directions. So one is around mechanisms that that theoretical framework I showed at the beginning of how mindfulness might influence well-being. There are very few formal mediation analyses actually testing that framework in terms of if changes in those mechanisms actually translate into changes in health outcomes in the presence of a mindfulness program. And so I think continuing to really understand the mechanisms, whether they're behavioral or physiological or cognitive, will really help us understand how mindfulness programs work, and through doing that, we may be able to customize them to just engage very efficiently with the mechanisms that are important and to let go of the things that aren't important. Delivery systems is really up right now in society as we're seeing the growth, for example, of apps and online delivered mindfulness programs, for example. Or how do we deliver a mindfulness program in a grade school setting? How do we deliver it in a corporate setting? Mindfulness-based stress reduction is 2.5 hours once a week for 8 weeks, plus an all-day retreat. It's hard these days to have someone in a corporate setting take 2.5 hours time out of the day, or to get their employer to pay them for 2.5 hours. So they often do these lunchtime sessions and stuff and that are an hour, and that may be fine too. But I think where the research is going is, when we're looking at different delivery systems, how well do they work? Something like Mbsr, MBCT are often considered the gold standard. But then can we adapt to meet people where they're at? I think most people who take mindfulness programs these days are of white racial ethnic background and upper middle class. And so there's all the rest of society there. And so do we need to adapt through timing or delivery system to be able to meet people of a variety of backgrounds? But if we're going to do that, let's do the research in terms of really high quality, randomized controlled trials that are replicated by multiple groups, removing biases, including from corporations, to be able to just really see where the evidence is and how it works. I think implementation science is a really big thing. So say that cost effectiveness slide, that's often I'm hearing is one of the more powerful slides in this talk. So and there's not many of those studies yet. And so from a health insurance perspective, we need to think about how to create, I almost think of it creating a round peg to go into a round hole instead of a square peg to go into a round hole. So when we're developing mindfulness programs, if we can keep the end users in mind and develop those programs to meet them. And so in the United States, this is a big thing right now where we often have implementation science experts on our grants and on our projects because they're used to working with health insurers and community members to understand how this intervention is going to land with them so that we're not wasting our time developing an intervention that's actually not going to be utilized or reimbursed by health insurance companies, for example. So I think a real strong focus on the end users is really a big place we can be going. And also if and how to adapt mindfulness programs to specific patient populations or specific demographic groups. So for example, someone like Jeff Prue, who is a scientist at the Oregon Health and Sciences University. He's a Native American researcher who's working with Native American tribal groups around the United States to use a community-based participatory research method to offer like the framework of Mbsr to these tribal communities and to get feedback from them on what in their culture can be infused into Mbsr with a particular focus on helping manage diabetes. And so it's sort of an example of, do we need to adapt Mbsr to different cultural demographic groups or to specific patient populations so that people feel like they're heard and felt and helped by those particular programs, while perhaps being aware of, if we have so many adaptations, then how do we train up society and instructors to offer them? And so if we start to have many adapted mindfulness programs for different demographic or patient groups, then we need to find the instructors to teach those and to train those instructors up to do it really well. And if something like Mbsr or MBCT works just fine, then let's not change it. But if there's a way to adapt it where it would work better, then let's do that. But recognizing we're 40 years into Mbsr research and you can see where we're at. So it's not a small thing to adapt a mindfulness program if you want it to be one day considered for reimbursement and grand, uptake. And so we're in this phase of history right now where I feel like there's a lot of experimentation on adapting mindfulness programs. And my feeling on it is that's okay. In fact, it's probably a good thing, so we see where it works and where it doesn't, but also keeping in mind that implementation science perspective of most behavioral programs have the life of the researcher who developed it. And then they often get it to stage 1 or stage 2 and then move on or retire. And if it doesn't have the infrastructure or the capacity to really help, then it'll die. And so let's adapt where it's useful, but let's do it really well with really strong methods and get to the truth, and also consider comparative effectiveness studies of, say, for me, I've developed this mindfulness-based blood pressure reduction, but one of the projects I want to do is to compare it head-to-head with Mbsr, so that I'm not wasting anybody's time training up a whole new generation of Mbsr instructors if it doesn't actually outperform something that we already have a large number of instructors for. So those are some of the ways that we can be considering, building it out. I think, some of the other areas around cost effectiveness that we've already talked about, and also around safety. So Ruth Baer out of Oxford University just came out with a really nice, balanced paper on looking at potential adverse events of mindfulness-based programs. And so this is something that so far the research that is done, active monitoring of adverse events, it's not showing differences yet, it seems, between the intervention and the control groups, but there's still not much research out there yet. And for people that have gone through retreats, long retreats, 10-day retreats, for example, who maybe didn't have much of a teacher presence there, for example, and might have had some predisposing conditions like PTSD or trauma history, or there can be adverse events that can take place when people start to come closer to their thoughts and emotions, and if they're not supported in a really effective way, then that can be really difficult. And so I think in my opinion, we need to do just a really careful look with the mindfulness-based programs on safety, so that we truly understand any potential adverse events, the frequency of them, and if there's ways to adapt that are more trauma sensitive, for example, or really understanding the importance of a well-trained instructor that is able to engage with people if they're having a difficult time, to help them move through it. And it's something, this is just up in psychological science as a whole right now, is my understanding. But I think the mindfulness field has a real opportunity to just go deeply into this and just really understand it, so that we can see any kind of boundary conditions, or who mindfulness programs work best for, and who they might not work for too. So I think a real careful look into the safety, in my opinion, is another important area. Another one is diversity, which I've talked about. Diversity could be thought of in many ways, but for example, by race or by culture or by age or by gender, by socioeconomic status, by intellectual ability. So there's many ways that we could be thinking about if and how mindfulness programs can be serving everybody. And then also this mixed methods approach. So today, even in this talk, you could see I brought in some quotes from participants as well as the quantitative data. And what did that do when you saw the quotes, when you saw the qualitative elements? And there's not a lot of qualitative data right now on mindfulness-based programs. And it's something that we're doing quite a bit right now, where I might come in as a scientist with my hypotheses on the mechanisms of how mindfulness might influence something like blood pressure. But what we've been doing is asking the participants themselves. In many ways, they're the experts, because they're the ones with the high blood pressure that have gone through the program. So we're asking them these open-ended questions of how do you think it worked? How do you think it influenced your cardiovascular health? And seeing what they say. And so those open-ended questions help us really understand the richness and the diversity of mechanisms and approaches of just how mindfulness might be influencing well-being, that I think is still yet to be fully tapped. And I think one of the other areas is around creating this infrastructure for high-quality, evidence-based mindfulness teacher training. And so as we think about governments or health insurers considering funding evidence-based mindfulness programs, one of the things that they really look at is scalability. So can it be scaled at the country level or the state level? And if so, who's going to teach it? And how do we know those teachers are well-trained with a standardized approach that has good quality control and quality assurance on the effectiveness of those teachers, so that we know that patients are getting programs that are consistent with the science? And so there's different groups out there that are really working on this. One of the ones that Brown is one of the leaders of is with this Global Mindfulness Collaborative that has members from countries all around the world, including Denmark, that Lona is one of the real leaders in around this, along with her colleagues. And so what we're doing is, as we develop, something like Mbsr and create tools like the MBI TAC, the Mindfulness-Based Intervention Teacher Assessment Criteria. This is one of the best tools out there, probably the best for measuring quantitatively and qualitatively actual mindfulness teacher quality in the classroom. And so as we develop these tools, a lot of that development has been out of Bangor University with Becca Crane, and also Exeter and Oxford. But we can look at best practices and best curriculum and best teacher training programs, and then scale that out globally, see how it gets translated into different cultures and different languages, such as in Mexico or Argentina, for example, or Spain or South Korea. Hear how that's translating out, get that feedback back to us, essentially, so that we can be seeing how programs can be scaled and developed with really high quality and assuring strong teacher effectiveness in the classroom. And so I think this is one of the other real areas of growth right now. We're just at that phase right now to make sure that we've got that global infrastructure or infrastructures. There's not just one, but there's multiple ones on how to support teacher training. This is a meeting we had for the Global Mindfulness Collaborative, some of the leadership of it in Italy just a couple of months ago. I think you'll see Lona here, for example. But we've got members, from Mexico and Finland and Italy and Spain and France and Argentina. So it's a really lovely group of people that are committed to high quality mindfulness teacher training programs. So just in conclusion, I think my opinion, this is just like the number of publications on mindfulness per year by year, so you can just see this rapid increase. So the findings are promising, and the research activity it's high right now. And there's certain areas that are becoming reasonably well understood, like Mbsr for stress and pain management, and MBCT for preventing depression relapse. I think there's areas that are emerging where the evidence is still building and still inconclusive. So things like mechanisms and delivery systems, safety, cost effectiveness, implementation science, diversity, equity, and inclusion. And in my opinion, at this point in time, that methodological rigor is paramount. We're doing the best quality science that we can so that we just get to the truth, that we're not wasting anyone's time going through programs that don't work. And we just see what works and what doesn't. And with the amount of awareness of the media and of society on us right now, this science is what's going to hold the field up. There are some negative articles coming out right now that happens for any field, for example, and it's the science that helps us, the science and just the wisdom of it that helps us really see the truth. And so, from my perspective, I'm really quite encouraged by the science on it, but I think a real emphasis on strong scientific methods is what's going to let us have the long game in this. And the people in Denmark, including the Center for Mindfulness here, from what I'm seeing, are some of the leaders in really good quality science coming out. So it's a real pleasure to be here, and an honor to present to your group too. So thank you. Mm-hmm.